thought about what beauty is? Beauty is biology, and the human desire for beauty is genetically programmed. Beauty is a social currency that rewards the lucky beholder. Beauty is not one size fits all. Hi, I'm Dr. Monica Bonakdar. I'm an aesthetic medicine specialist practicing in Newport Beach, California. I'm the creator of Monbon Clinical Skincare and Amplify Filler Technique. You are listening to Beauty Heroes Podcast, where I chat candidly with trailblazing beauty leaders, examining, questioning, and challenging everything you thought you knew about beauty and the current beauty standards. My goal is to make beauty more inclusive and accessible to all aesthetically oriented men and women. All right, let's do this. Hello, everyone, and welcome. Today, we are speaking with Jeff Snider with AccuVein Company, which sells a device by the same name, AccuVein. Welcome, Jeff.
Hi, thank you for having me on. I'm honored to be here.
Of course, my pleasure. Okay, Jeff, so can you tell the audience what AccuVein is and what you do for the company?
Well, AccuVein is the world's #1 vein illuminator. It shows all the blood vessels beneath the skin down to 10 millimeters. It's the first such a device that's non-contact, and it was the first device introduced to the world about 10 years ago. And now we have about 90% of the world's market for this technology, which is vein visualization.
So this device has been around for 10 years?
Yes, it was developed back about 12 years ago by AccuVein, and we have many awards, many patents that we've been awarded, and many awards for the design of the product, and is used all over the world now by 5,000 facilities, various kinds of venous access to be able to see all the blood vessels beneath the skin.
So it's not only used in aesthetic medicine then. The way I describe it to my patients, which really pulls at their heartstring, is that it was developed for pediatric oncology to be able to draw blood from these little guys that have had so many blood draws that they don't have healthy, good vessels, and their blood draws are very difficult. And it then progressed into aesthetic medicine. So tell me why it is such an incredibly useful tool in the field of facial injectables.
Well, we discovered it because after developing it for venipuncture access in the hospital, where everyone has a relative that has been stuck multiple times. Everyone has a child that they have difficulty finding the small little blood vessels in a child's arm, and only in the oncology department of pediatrics, it's only more difficult when they're on chemotherapy. So it was a natural offshoot in the last, I would say about 4 years ago, we entered the aesthetics market. An aesthetics physician probably got hold of our device and said, this would be great for cosmetic injections when people are getting a neurotoxin, or such as Botox, injected into their face, or a filler, as I watched you beautifully do in Vegas a couple of weeks ago during that course we were working on together. So when they're getting that done, practitioners who are doing the injection want to be able to avoid all the blood vessels when they're injecting either Botox or filler injections. They want to not nick a vein or bruise the patient, or worse, having a worse complication from those injections.
So considering that a bruise can take up to 2 weeks to resolve, this is a huge advantage to use an AccuVein to miss the vessels and not bruise during an injectable session. So my question is, why doesn't every injector doing facial injectables use one of these?
That's the question for the ages. That's the $60,000 question. And I would have to answer it always. The reason for many questions, the answer is always money. So a lot of injectors don't think they need it. And just that's why even about half of all the hospitals in the U.S. have AccuVeins to make sure that they're being able to draw blood and start IVs effectively, quickly, and with minimal discomfort for the patient. But a lot of nurses don't think they need the help of a piece of technology or a device. And a lot of injectors in the aesthetics field don't think they need a device to show them where all the blood vessels in the face are, even though great physicians like yourself, Dr. B, you know that everyone's face is different and blood vessels are located in all different parts of an individual patient's face. So where you think one blood vessel or artery might be on one person's face shows up somewhere totally different. And patients love it when their injector, whether it be a physician like yourself or otherwise, are using an AccuVein. They love it when they show, when the injector shows the patient on their arm. We're using new technology today to lessen the chance of bruising you. Patients go crazy. They go, oh my gosh, how come no one's used this on me before? And why is that? And it's always because of money. They don't think they need to spend the money on the device, even though it gets huge traction and it's really a benefit for the patient.
So are injectors charging for this service?
I only know a couple of injectors have asked me, can I charge for it? Injectors are typically not charging. I only know of one physician somewhere in the middle of Texas, out where there's tumbleweeds and things. He was going to charge patients an extra. He was going to ask if they had a special occasion coming up and was going to use that as a lead-in. Well, sounds like we better use the AccuVein on you. You don't want to bruise. You've got a wedding coming up in like a week and a half.
That doctor sounds like the restaurants that charge you for refills on your soda.
Exactly. Do you want some extra soda? Do you think you're going to be wanting extra soda pop tonight? Exactly.
Yeah. So for the most part, this is an added value. If you go to the right injector who cares about your fears, and one of the fears being fear of bruising and downtime, if you go to that right injector, they're going to use all the tools they have to make sure that not only do you have amazing results, but that your downtime is lessened and your pain is lessened.
Absolutely. It only takes, you can tell me better than I can say, but it only takes usually about 30 seconds to scan someone's face and get an idea of where all their pertinent blood vessels in the area are going to be. And that 30 seconds has a huge payoff with the patient. Because they'll say, well, my physician really cares about me. They're taking a little extra time to make sure they don't bruise me. And then they'll do usually more procedures with you because of that. They have extra confidence in their injector.
Yeah, I mean, I can tell you from my experience that you could do a beautiful job with amazing results, but if they have downtime in form of bruising, most people are not going to first remember the amazing results. They're first going to remember that I bruised them. And when you train them to say, you know, your vessels are a little bit more fragile than the average patient I see, make sure I don't touch you without my vein finder, which I call the red light, then they'll remind me, and they're just so thankful and delighted when they don't bruise.
Absolutely.
But I understand that the red color is now changing to green because of a new generation AccuVein. So tell me about that, Jeff.
That's right. The new generation is called the AV500. The previous one was called the AV400, and it now is green. So the laser is different. It makes it green. It actually is a class 1 laser now. So it's even safer than before for use around the eyes, where it has such a huge impact on lessening bruising. And it is brighter. It's crisper. It is the same body. It's in the same size, which is only less than 10 ounces. So it's very lightweight still, but it's safer, brighter, more effective, and more robust. So that's why we're able to extend the warranty on it as well from before. it has great success, great welcoming at the aesthetic show we were just at in Vegas, and people seem to love it.
When is your AV500 AccuVein going to be available?
We announced it a few months ago, and we're trying to catch up with orders. We're about 1,300 orders. People have been pre-ordering it, so it started to ship already. The practices that ordered it about 90 days ago are just starting to get their shipments now. So we are trying to catch up. It's available now.
Wow, that's great. So that means that all my patients that I've trained for the last 4 or 5 years to come in and say, make sure, Dr. B, that you use the red light. Now they have to call it the green light.
Well, as long as they're asking for your light, that's the greatest thing. So whatever they nickname it, which we find in practices all over the country, the patients are nicknaming it something.
Tell me about some of these nicknames. I'm curious.
So in one practice that I can think of, they call it the doctor's medical stud finder, which I think is good.
I like that.
Another practice, they nicknamed it the doctor's anti-bruising laser, or some practices they call it, like one practice I know of, they call it the name of their favorite nurse there, which is Leslie. So the patients come in and say, I hope you're going to use Leslie on me today.
That's funny. How long have you been with AccuVein?
I've been associated with AccuVein for almost a little over 5 years now. I became aware of them. I was an independent rep, and I saw the device on one of my friend's LinkedIn page, and I was love at first sight. I saw it and I said, what is that? It fit all the criteria that I wanted to have in something I was selling. It doesn't touch anybody, doesn't hurt anybody. It's totally safe. It helps people to get procedures easier and without complications. And it was light because you know that I live in Florida. So I wanted something that was easy to take in and out of my car. It's less than 10 ounces. And it just was beautiful. We've won many awards for the design of the AccuVein. It's very beautifully contoured and fits in your hand. And I fell in love with it. So that's when I started being involved.
It practically sells itself.
It does. It does sell itself, except when they ask, when the practitioner asks, how much is it? So that's when I have to justify the price, as I just, discussed with you. But up to that point, it does. And that's why I sold so many when I first started 5 years ago and became the director of sales.
Wow. Out of curiosity, should we discuss pricing or not discuss pricing?
We can discuss pricing if you want in a general way. So the AccuVein comes with the availability of a hands-free stand so the practitioner can use it without holding the device. The hands-free stand goes up and down in height so that you can use it with cosmetic injections, or you can use it at a lower height for like blood draws, which a lot of practitioners use it for blood draws for protein-rich plasma procedures, PRP.
Platelet-rich plasma, yeah.
Platelet-rich plasma, sorry about that. And so they use it for that, and use it for leg veins as well, for taking care of spider veins and those kind of varicosities. So anyway, it comes with that at $6,800 normally. Without the hands-free stand by itself, the AccuVein is normally $5,500.
Okay. Again, that goes to prove that it's such an amazing tool for such a fair price. I know that I feel naked without it in the treatment room, and I never want to inject anyone without it. So for me, it's just been a godsend.
Thank you very much. And I watched you do injections again out in Las Vegas at the aesthetic show, and you had such a crowd of people around your bed where you were doing live injections on a patient using the AccuVein. And you have such a great demeanor and way about your bedside manner, I should say, that it was really a pleasure and an honor for you to be using the AccuVein there.
So my patient, Jeff, at the aesthetic show was one of the executives that runs that entire show. And what she told me is that first session was for the neurotoxin injection, and then she came back for her filler injection. So when she went back to her office and to her people between the two sessions, they said, oh, they didn't use you as a model? And she says, no, they did. And she asked, well, why are you saying that they didn't use me? Well, because she didn't have any bruising anywhere. So it just goes to show that with the results of something like a neurotoxin, you got to wait the obligatory 5 to 10 days. But even before the results set in, a bruise that starts to form, you can tell right away. So they just assumed that she wasn't a model because she didn't have any bruising.
That's great. And a lot of patients actually don't tell their physician that they bruised because they like their physician. They feel a little intimidated. They don't want to, rock the boat, so to speak. In certain cities, like where you are in Southern California, they will, or in New York City, but in the middle of the country, they won't tell their injector that they bruised. But I have lots of pictures of patients that people have shared with me. This is a bruise that I never told my injector. So a lot of physicians, to answer your question from earlier, why doesn't everyone have this? A lot of physicians say, I just tell my patients, you're going to bruise. And of course, they don't have to bruise, because if you're looking at all the blood vessels proactively beforehand, a roadmap, we find that bruising goes down, especially like under the eye, by 85 to 90% with using the AccuVein.
My favorite picture in anatomy is where they have filled the vessels with an embalming fluid and then melted all the soft tissue. So all you see is the conglomeration of all the vessels. And it's like the entire face is made up of blood vessels. So it would be trying to run a marathon in a landmine. There's no way that you can safely put a needle under the skin without bruising them. So in a way, you should be interviewing me about how much I love this.
Oh my gosh,
device.
I should be, and I want to. And the face is so highly vascular. There's landmines and danger zones, as you know better than I do, all over the face. I've been to many cadaver courses, I'm sure you have, and I've seen lots. Of matter of fact, like at the booth at the, not to keep harping on the aesthetic show, but a lot of practitioners came up and go, oh my gosh, when they took a look at someone's face, like my face with the AccuVein, they go, oh my, if I had known this, I never would have started injecting. And so
yes,
it's a little scary at first, but for an injector to go in blind, it's like walking through a war zone of filled with landmines blindly, not knowing where those hidden landmines are.
It's a bit of being naive. And what sometimes I describe to the patient is that no wonder the last several injectors bruised you, honey. You don't have vessels. You have lakes. All I see is black from where the near infrared light is illuminating where the vessels are, and they go lakes. I say, yeah, you're a very difficult injection, and make sure I never come towards your face with a needle without my red light shining on your face.
And that's why it's so great for a patient to go to such a great caring practitioner such as you, Dr. Monitor, because you really care. And as you well know, a lot of patients just look for, the cheapest procedure they can find anywhere. And it's not always about that, because if you bruise or something worse during a procedure, the sweetness of the great price rapidly goes away, faster than the bruise does.
Yeah. Yes. So it's not just about buying a cheap injectable. It is experiencing an amazing service and being delighted by the whole experience, not just the results, but the process to get to the results.
Absolutely.
And AccuVein is one of my best tools. And we made it really easy for people to remember. So we have the germy killer, and that's what we use on the face. That is higher grade than alcohol to clean the face with, and it's a hypochlorous containing product. Then we've got our red light, the AccuVein, to show us where the vessels are. And then we have the world's tiniest human vibrator. And that's another tool that I use to kind of confuse the nerve endings and the brain, because the vibration gets to the brain faster than pain. And so you don't experience pain during injections.
That's great.
So with those three things, my germy killer, red light, and micro vibrator, I am giving patients amazing filler results without the fear of pain, fear of bruising, and fear of unnatural results.
That's fantastic. I would go to you. I would definitely go to you for my cosmetic injections, because those are I hate germs, I hate pain, and I hate bruising.
Watch out for what you say. The filler and toxin injectable sessions that I do at these conferences are always looking for models. So the next time they need a male model, I'm going to say, oh, I know someone and bring you in, Jeff.
I would only be injected by you, and I've purposely not had any cosmetic injections yet. I keep dangling my face, which is obviously in need of cosmetic injections. I dangle it as a carrot for someday someone gets to inject me.
Well, it would be a pleasure to work with you. Well, Jeff, thank you so much. Where can our aesthetically oriented clients find more information about AccuVein and find providers that are using AccuVein in their practices?
So they can go to AccuVein.com, ACCUV as in vein, EIN.com, and see the device. There's videos there, and see the device in action. And they can either email and say, call me now, or they can just call directly. The number is 888-909-8888. And they can request to speak with me and put a message in with me there, and I will contact them quickly, same day, many times. And we can have either, if they know about the device already, or we can have one of my reps. I have reps all over the country that can go do a demonstration of the AccuVein in their office. And I'm sorry about all the emails. We're getting so much response after being at the aesthetic show with you, Dr. B, that tons of emails are coming in for people that want the AccuVein.
Tons of providers who want to use the AccuVein,
yes.
You mean?
So the green light really seems to be, we were concerned about it initially. We didn't want to come out with a next generation product, but we had to. There was a component in the red light that went not available going forward, so we had to change the laser to make it green. So we were concerned about that, but it seems like everyone's embracing the green laser light color as a friendlier, more patient-friendly, and it's brighter, and everyone seems to like it a lot.
So on your website, Jeff, if it's a client, not a doctor, not a provider, if it's a client, there is a page for them to inquire who in their area uses an AccuVein. Am I correct?
Yes, there is a page. They can still call in that number or email,
fantastic.
And then someone will get back with them, probably me. If anybody wants to speak with me, they just can leave a message there, email, or call that number, and I'll tell them the best or choice of providers in their area would be that have AccuVeins.
That's fantastic. Also look at the hashtag AccuVein on Instagram to see the providers that are using it and showing their work while using the AccuVein.
Absolutely, because it's a great litmus test. It's a great litmus test to know that provider who's doing cosmetic injections really cares about their patients, and it's not just a place where they're trying to get in and out as many patients as quickly as possible. They care about them.
Well, Jeff, thank you so much for joining us during this podcast and educating us on the AccuVein. And I am very excited to receive my green light in the future.
Absolutely.
And start re-educating my patients that no, red light was yesteryear. Now you got to call it the green light. Thanks again for joining us.
I'm so honored to be here. Thank you very much for inviting me. Thank you.